Good afternoon, I'm Mabel Jong and you're watching continuing coverage of the World Healthcare Congress 2015. We're on day one of the event and I'm so pleased to have with me in the studio Mila Kofman, who is Executive Director, DC Health Benefit Exchange Authority. So great to see you, Mila.
Thank you for having me.
Well, tell me a little bit about DC HealthLink. Let's start from there.
Sure. We opened for business October 1, 2013, and we have individual customers. We also have small business customers who come through us. They shop online for health insurance and they enroll through us online for health insurance. We also serve all of Congress, including their district offices. And in December of 2013, the President of the United States enrolled through us in an individual coverage plan.
Was this a direct response, the opening of DC HealthLink, to what was going on with the Accountable Care Act and just really opening up a marketplace immediately based on what the President had said?
Yes, it took, so states had the option of building their own health insurance marketplace online or inviting the federal government to do it for them. The district chose to build our own early on, and the city signed its IT contract in January of 2013. We had about 8 months to build our own, and on October 1, we were open for business.
Now, would you describe DC's patient pool different from others that rely on federal government aid?
So 10% of our enrollees are folks who qualify for tax credits. 90% are full pay. So that makes us a little bit different from all the rest. In most states, you have the majority of the enrollees qualifying for reduced premium tax credits.
Okay. And would you describe the model that you've based DC HealthLink on as something that can be replicated in other states?
So our approach is we don't negotiate benefits, we don't negotiate rates, we invite all health insurance companies to come in and compete for your business. And that has resulted in great outcomes for our customers. We have 3 carriers on the individual side, 4 carriers on the group side. Last year we had 267 different products on the group side. This year we have 192 different ones. On the individual side we have 31 different products this year. So it's really, we've opened up the market essentially. Everyone can come through us and have great prices, great choices. What we've done certainly can be replicated in other states. In fact, if the Supreme Court decision turns out in a bad way for people, we're going to help out all the other states as well.
Let me ask you your opinion on experience then, both from the customer experience, the plan experience, and the provider experience. How has it been from each of those different groups, being affiliated with DC HealthLink?
So it's been a very close partnership with all of our stakeholders. We have a business relationship with all 3 chambers, the DC Chamber of Commerce, the Restaurant Association, Greater Washington area, and the Hispanic Chamber of Commerce of the Greater Washington area. We make all of our decisions very much through the community with stakeholders at the table, so all of our policy decisions reflect the priorities of the community, of people who live and work in the district, and we've been built from the ground up, and that's really helped a lot.
Okay. Would you anticipate any changes in the way you're doing business now, or is it exactly what you had envisioned when you first opened your doors?
We like the transparent process. We like stakeholder-driven process. Everyone's voices are heard. And so I anticipate that being our approach for a long time. It's worked really well for us. We've enrolled over 95,000 people. Lots of people have come through us. They've had great choices. All of the health plans are commercial networks, essentially. We don't have some of the issues that consumers have with accessing providers in other states. So it's been a very working process for us.
Okay. Well, Mila, thank you so much for the update on DC HealthLink. Thank you for your time today.
Thank you.
And I'm Mabel Jong. Thanks for watching.